Melissa Meiste from Nephew Physical Therapy, here to talk about posture. Oh wait, this video is about elbows. Oh yeah, it's because they're related. Ever get elbow pain right here? Well, that's commonly known as tennis elbow. In our world as physical therapists, we call it lateral epicondylitis. What is that? Well, it's inflammation that occurs right here where all the muscles on the back of your forearm attach just above the elbow and are responsible for this motion. Grasp, lift, grasp, pull, grasp, pick up. Repetitively, over and over and over again, overusing these muscles right through here so that it tugs, and actually where the tendon then meets the bone, it starts to create a lot of tension. Tendinitis is basically where the tendon meets the bone and there's a ton of inflammation because our body will break down in the areas where there's a transition in material. So for example, if you took two boards and nailed them together and applied pressure, they're going to separate not in the middle of the board, but where the two boards meet. Same thing happens with tendinitis. It's repetitive, over and over, tugging, pulling, that then gets irritated and ticked off. And if you have it, you know exactly what I'm talking about. You could almost point right at it right here at the elbow. So, you don't play tennis. True. You can get tennis elbow and never have picked up a racket in your life. As I already described, it's common with overuse, grasping, gripping, and lifting in a palm down position. This can happen in many manufacturing jobs. We see it in the labor trades. Heck, I get it a lot just because I'm using this stupid thing too much. But here's really the connection. What I have seen over the last, oh my goodness, what are we at? 22 years of being a physical therapist. What I have seen is there is a direct correlation with weakness in the shoulder and overuse of the elbow. So if you've watched any of our other videos, you've heard me say many times how if you have pain in your knees, it's because you have a weak butt. Well, the elbow is like the knee of the arm. It again has a lot of influence coming from the shoulder that then puts it either into a good or bad position. So let me show you how posture and weakness in your shoulder blades directly affects the function of the elbow. If I am standing rounded and in. Now, most of us aren't standing like that every day, but let's be honest. We're not upright like we should be. We're forward and in. When I am forward and in, what you'll see, if I back far enough, is the whole thing rolls in. So now, instead of my wrist and thumb being in neutral position, my starting position is here. It's rotated in. My thumb moves in towards my belly button. What that means is if I'm going to go then use my arm to hold something, now I don't get to start from here to here. I have to go all the way from here to here to get to the position I need to be because we're not starting in neutral. And that is coming from lack of strength and the rotator cuff muscles and the scapular retractors of the shoulder. So, what have I found has been the best treatment in regards to treating tennis elbow? Well, of course, it's icing. It's avoiding palm down lifting. It's staying away from the stuff that aggravates you. It's stretching that forearm. But what we really focus on is one, you need a lot of manual therapy in here. We got to release those tissues. But two, you need to be stronger in pulling your shoulders back, in rotating your shoulders, and you got to have flexibility through here. That's the top level stuff. There's a lot more things that we usually incorporate into treatment, but that's why looking for the root cause of these symptoms is what matters. I can always throw a Band-Aid on something. I can always just tell you to ice and stretch, which again is a great place to start, but it's not going to get you to the resolution that you need because the other thing is as soon as you stop icing and stretching, it's going to come back unless you again resolve what is either super tight, like the chest, or the weakness that we find to the back, because when it comes to posture, gravity always wins. We have always got to be fighting back. So keep that in mind. If you or somebody you know is having elbow issues, yes, there are things that you can try at home. Absolutely do those. Ice, stretch, avoid things that aggravate. But I'm telling you, physical therapy is one of the best choices you can make in regards to resolving that problem, investigating where it's coming from, getting to the root of the issue so that you can be free to do whatever you want to do, even if it's not tennis. So as always, this is Melissa reminding you that pain is not normal. Do something about it.